Hello and welcome. It's 6 p.m. UK time, so it is time to start our live event. And I'm happy to be back with Dr. Alpesh Doshi. Hi, how are you feeling today?
Fine, thank you, Caroline.
Happy to hear this. And well, I hope you had a wonderful weekend, everyone. And just let us know that you can hear us both, so we will be able to simply go ahead with some of your questions as well. But first of all, let me just remind everyone that we are here every single day from Monday till Friday so that you can learn, you can find out and to meet the top experts in the fertility. But also you have a chance to simply ask your questions. And of course, all those events started on the 1st of April, and we will continue through the whole month once again for so that you can learn even more. So this is today we have 1st of June, and we will have plenty of the events coming up as well. I'm really glad about that. And so, well, just let me remind you that all of those events are brought to you thanks to our ambassadors and partners. And as always, you can see them right here. So thanks so much to all of them. And well, tonight we do definitely have another interesting topic to discuss, which is egg freezing and fertility preservation. A patient's guide. And as I've already mentioned to you, our guest is Dr. Alpesh Doshi, who is a clinical embryologist and co-founder of IVF London. And I heard that it's a very nice weather right now in London, so I'm really happy to have you back with us. And that is it from me, actually. Dr. Alpesh, are you ready to begin with first your
Yeah,
presentation?
certainly I am. Thank you so much.
Excellent. Excellent. Happy to hear that. Here's your presentation, of course. And just one more thing, just remember that we will start with the presentation, but afterwards it will be time for your questions. So all you need to do is just type those questions in the chat section. And well, I'm sure you have plenty of those. So don't miss your chance to ask anything that you want to know and find out. All right. Perfect. Thank you so much. And go ahead.
Thank you, Caroline. Thanks for that kind introduction and a pleasure to be on your platform for a second time. I am just by way of introduction, Caroline has already introduced me, but I'm Alpesh Doshi. I'm a consultant clinical embryologist by training. I'm a co-founder and clinic director at IVF London, a very new IVF clinic established in 2018 in Hertfordshire, part of the UK. I have got quite a bit of experience in embryology, and I also have a very passionate interest in academics. I'm a lecturer at University College London and lecture on 2 of their master's courses on reproductive medicine. I was one of the first scientists to bring egg freezing to the UK in 2005 from Japan, especially the new technology of vitrification. And I'm going to be talking a bit more about the whole egg freezing technology, and of course also elevating any concerns, myths around egg freezing. So we'll be going back to basics as part of this conversation and of course the presentation. As Caroline said, the opportunity is there to ask any questions if any of you are considering egg freezing as patients. Then by all means, do ask any of your questions that you may have. So what is egg freezing? Egg freezing is retrieving of eggs from the ovary at the right time and then cryopreserving them. So what cryopreservation means is storing the biological cells at very, very low temperature, as low as minus 196 degrees C, which is in liquid nitrogen. And at this temperature, all the activity in the cells or all biological function stops in the cells, and hence you can preserve them without deteriorating the quality of the eggs itself. And egg freezing is one way of fertile women wanting to preserve their fertility. So if they are not ready to start a family now, they can be when they want to. So it allows them a lot of freedom over their reproductive potential. Why do women choose to freeze their eggs? So there are many conditions that kind of do make women consider egg freezing. So there are various categories of women who consider egg freezing. One of them is if a woman has a medical condition which can potentially make her infertile, such as cancer. So we all know that as part of the whole cancer cure or the therapy, chemotherapy or radiotherapy is one of the treatments that is offered to women who may want to consider some treatment for cancer. Now, as a result of this chemotherapy and radiotherapy, women may lose their fertility because the drugs that they're given, they are very harsh and that can also make them infertile. So before women consider any kind of chemotherapy or radiotherapy, they may have an option to freeze their eggs in order to preserve their fertility for future. But at the same time, there's a huge number of women who are now considering fertility preservation purely because they're not ready to have a child for various reasons. Maybe it's their careers, maybe it's their education, and want to just have what we call an insurance policy. You may recall that there are couples who choose to freeze the stem cells of their children when they're born. And again, this is an insurance policy. So again, with egg freezing, a lot of women who are not ready to have a child, who may be in their 30s or early 30s, may want to consider preserving their fertility, may choose to have egg freezing for social reasons. At the same time, you can have, I've had patients who are either working in the armed forces or have been deployed to war zones who may want to consider fertility preservation. And I've definitely been, I've been assisting a lot of men who have frozen their sperm before they were deployed to Afghanistan or Iraq for serving the country. And we have been able to help a lot of these men to preserve their sperm in the event they do not have the potential of having their child or producing sperm naturally. We also do see that quite a few of transitioning patients who are either transitioning from a female to a male may want to consider freezing their eggs as well. So even in patients who are transitioning in terms of their gender, they can also opt to preserve their fertility. So specifically women who are becoming men through surgery or hormonal therapy are or can consider fertility preservation. So what are the dilemmas that women face today? Some of the dilemmas are academic education, wanting to excel in their careers, wanting to get onto the income ladder, and of course fulfill a lot of the other activities which doesn't tie them down to families, when the time's right for them. On the other hand, the women are always trying to balance the pros and cons around seeking a long-term relationship, getting pregnant or conceiving, considering maternity leave, because if they take maternity leave, if they do get pregnant, that's going to potentially affect their careers. And of course, they are also trying to balance the amount of time that they want to spend at home once the baby is born in the early years. And these are common dilemmas that women face these days in terms of trying to balance the pressures of modern day living versus reproduction. Now, what role does age play? We know for a fact that a woman's chances of conceiving naturally fall as she gets older because the quality and the number of eggs drops with age. Egg freezing is a process which allows patients to preserve their fertility by freezing their eggs when the woman is young and the eggs are of the highest quality. So this is a lovely graph which actually demonstrates what is the decline in fertility as women age. So you can see that certainly after 35, there's a very rapid decline in a woman's fertility potential, and the quality and the number of eggs in their ovaries does drop, and certainly in the 40s, the drop is so high that the chances of conception are very, very slim. And at the same time, the risks of genetic abnormalities in the babies born can be very high as well. So again, we know for a fact that the quality of the eggs goes down and the number of eggs goes down with age. But at the same time, it needs to be understood that the risk of miscarriage also goes high with age. So you can see the curves there. The curve in blue is the miscarriage rate with age, and the curve in red is the live birth rate with age. So as the curve for live birth rate drops, the rate for miscarriage also goes up, simply because, as I said, there is more chromosomal errors in the embryos. So, as I mentioned, there is an increased risk of genetic abnormalities, and the risk of having an ongoing pregnancy with a genetically abnormal embryo also increases with age. Such pregnancies potentially can be terminated or result in a live birth of children with some major disabilities. Again, the age-related increase in genetic abnormalities is not linear in nature. Rather, the rate increases sharply when women reach their mid-30s, and hence, one of the questions that you may ask is, what is the ideal age for egg freezing? We certainly believe that it's in the early 30s, or certainly by mid-30s. Typically, after 37 or 38 years of age, there is a very rapid decline in the quantity and quality of the eggs. We also know from the American data that has been published that 1 in 5 American women has chosen to have her child much later on now. So again, we have seen that in time, women are choosing it much later, or are leaving reproduction to much later. Women are having their children much later on in life. And typically this study showed that from 2000 to 2012, there was a 24% increase in women having their first child between the age of 35 and 39. And around 35% of women chose to have their first child in their 40s. So this translates into a 50-fold increase in the annual number of IVF procedures performed in the US since 1985. And again, I must say that in this sector, there is very limited data for the UK or the European countries, but there's a lot of data that has emerged from the American subcontinent. We also know that age has an adverse effect on IVF outcome. The chances of a live birth after a cycle of IVF plummets from 41% at the age of 35 to 4% after the age of 42. The extent of this fertility decline is not appreciated by most non-infertility physicians, the general public, or men and women who are delaying childbearing, and hence it's very important to make yourself aware around fertility education. I think we need to also make, I go and lecture at a lot of universities as well, making women understand what the decline in fertility is with age, so that they can potentially consider avenues such as egg freezing if they want to when they are in their early 30s. We also know that the live birth rates also go down with age, and typically this just shows you that at 35 years old, the live birth rate is around 41.5%, and at the age of 44, the live birth rate would be less than 1%. So what does the process of egg freezing involve? There's three main the three main stages or steps of the whole egg freezing process. The first process is the workup, which includes an initial consultation and some basic tests to check for the hormones in the women, and also the virology or the sexual health screening. Stage 2 is the preparation, whereby you would have a nurse consultation, you do all your consent forms, all the paperwork, all your injections are going to be taught, and your medication can be purchased as well. And stage 3 is the actual treatment itself, where you would start injecting yourself with fertility hormones, and then over a period of 10 to 12 days, you'd be monitored in terms of the scans to see how those follicles are growing, and then there is an egg collection, and then finally freezing of those eggs. Now, it must be understood that it may be a myth if you have heard that egg freezing can take months and months. No, that's not true. From the time a woman has her period, and if we're using what we call a short protocol on women, then the whole process from start to finish can be finished in 2 to 3 weeks. And again, one only needs around 5 to 6 visits to the clinic in order to complete the whole egg freezing cycle. So let's kind of map out things a bit more. So the workup is the initial consultation, where you would see the fertility consultant to discuss the medical history and suitability for egg freezing. The tests that may be recommended by the consultant are typically the ovarian reserve test, to see what number of eggs we would be expecting as a result of the stimulation. One of the checks that we do is for a hormone called anti-Mullerian hormone, which is a very strong predictor of women's fertility. The other check we do is an internal pelvic scan for antral follicle count, AFC. And this is nothing but checking how many tiny follicles are present in each ovary, which would give your consultant an indication in terms of how, how the fertility hormones will reflect in performing when stimulation is given. So the combination of the antral follicle count and the AMH gives a very tailored stimulation regime and helps determine the right dose to give for hormonal stimulation to mature or grow those follicles in the ovary. Apart from these tests, as I said, there's a sexual health screen which women would have to go through. So there's a hepatitis B, C, HIV, and all the chlamydia, rubella, and gonorrhea tests would also be done. The stage 2, which is the preparation, which is the nurse consultation, whereby, of course, we will discuss the whole protocol with you, the hormonal stimulation, what drugs you're taking. We will also teach you how to inject yourself with the hormones. The nurses will exactly show you what medications are taken daily, and all the consent forms are also signed. And at the same time, your hormones or your stimulation or your medication is all purchased as well. A prescription is sent to the home delivery pharmacy, and your drugs will be delivered to you to your workplace or your home. The final stage, which is the ovarian stimulation, whereby the hormone injections are administered from day 2 of the cycle for about 10 to 14 days to keep on stimulating those follicles that are there in the ovary to grow larger and larger to produce the eggs. We would recommend that women have scans every couple of days to see how those follicles are growing in the ovaries. Now, when the follicles are at the right size, the patients will be asked to take a final injection called a trigger injection. And what the trigger injection does, it actually matures those eggs in the follicles and makes them ready to be retrieved from the ovary and frozen. So this trigger injection is an extremely crucial injection which allows the final maturation of the eggs inside the ovary. The egg collection procedure is pretty straightforward. Patients are given a mild sedation for the procedure, or it's called conscious sedation. And with the aid of an ultrasound probe, each of the follicles in the ovaries is pricked with a needle, and the contents of each of the follicles is withdrawn and sent to the laboratory, whereby the embryologist is going to be screening the follicular fluid to locate the egg. And each of these follicles is going to be screened, and the egg is going to be identified, and all the eggs that are collected as a result of this egg collection procedure are going to be taken into the laboratory. Now, the freezing and the storage is the next step. So once the eggs are collected, the eggs are stripped of all the cells around the egg, because when we perform egg freezing, we do not need any of those external cells whose role is nothing but to just nurture the egg within the ovary. But whilst the eggs are already out of the ovary, all those peripheral cells can be removed in order to maximize the survival rate of the eggs once we freeze them. So then the next step would be to dehydrate the eggs. So in order to freeze the eggs, we have to dehydrate them. When I say dehydrate them, you have to remove the water content out of the eggs, because having water in the eggs can make them very susceptible to being damaged during the freezing and thawing procedure. So removing the water is absolutely crucial and very, very paramount. And again, I have seen that in many laboratories, if this procedure is not done properly or it's not done with skill, the eggs will not survive the freezing procedure. So it's very imperative that the embryologist who freezes the eggs as a result of this new procedure called vitrification is skilled at performing the procedure and has a good track record of getting good survival rates and pregnancy rates from frozen eggs. Finally, once the eggs are dehydrated through various solutions that you have to take them through in the laboratory, they are then flash frozen in liquid nitrogen. The straws containing the eggs can then be stored in tanks containing liquid nitrogen for many years. So you may ask that, is there a difference in outcomes between fresh eggs and frozen eggs? And that would be a very good question to ask. And there have been some studies that have shown that there is no difference in various parameters or various embryology-based parameters with fresh and frozen eggs. So for example, this study is showing that there is no difference in fertilization rate, there is no difference in embryo development rate, and most importantly, there is no difference in blastocyst formation rate, which is an embryo which grows to day 5. A blastocyst is an embryo that develops to day 5 of development. So this is very reassuring to know that frozen eggs can have the same potential as fresh eggs. It is important to understand that in the UK, there is a law governing around egg freezing. So the HFEA, the Human Fertilization and Embryology Authority, are our regulatory body in the UK that govern all fertility treatment. And in the UK, we have a storage limit, which is set at 10 years, but this is out for current review at the moment. But at the moment, the storage limit is set at 10 years. In women who are at risk of losing their fertility, such as either if they're having cancer therapy, they can freeze their eggs for up to 55 years. For women who are considering the use of donor sperm, especially if you're a single woman, or if you're in a same-sex relationship, you may want to use donor sperm. We use very well-established UK and European banks to get a wide selection of donors to choose from. The process of donor selection begins by reviewing donor profiles, and of course we will be assisting you through that process and also enabling you to make the right choice based on the match or further information if we can provide that to you about the donor. So once frozen eggs have been allowed to defrost, say when you're ready to use your frozen eggs, they will have to be thawed out. And once they're thawed out, the method to inseminate them with the sperm is using a procedure called intracytoplasmic sperm injection, or ICSI. This method is so that we can initiate fertilization in the frozen eggs. The embryos that are created by inseminating those frozen eggs can then be monitored for 3 to 6 days in the laboratory, and then 1 or 2 embryos can be transferred into the uterus in the aim to establishing a pregnancy. So we'll get Caroline to play that video now, and that video is just showing you how we inject frozen eggs. So this is a frozen thawed egg, and you'll see that what we're doing is we've got a sperm in one of those very sharp pipettes on the right hand side. There it is, that's the sperm, and we're just going to be piercing through the membrane of the egg and then releasing the sperm in the middle of the egg. So we've broken the membrane, and very gently we are releasing the sperm into the egg. So as part of the egg freezing procedure, fertilization can only be induced by ICSI and not by conventional IVF. So we'll move to the slides again. Brilliant, thank you. So the success rates, and it's quite important to know that what are the success rates with frozen eggs. So the main factor influencing the chance of success is age at which your eggs are frozen. And of course, the earlier you freeze them, the higher the success rates in terms of pregnancy rates as well. So vitrification is a very successful freezing technology which allows us to get survival rates of the eggs between 90 to 95%. And again, there's a study that has shown that typically the survival rate of the eggs can also go down with age, but even after 40, we expect survival rates in excess of around 85%. It's important to understand that the pregnancy rate or clinical pregnancy rate per egg is 6% per egg. So hypothetically, if you have a 35-year-old woman who's frozen 10 eggs and has 10 surviving eggs, then her chance of getting pregnant is around 60% if all those 10 eggs have been thawed out. So what are the risks of egg freezing? One of the risks could be ovarian hyperstimulation syndrome. Again, this risk is very, very rare, and it's more precipitating in patients who have polycystic ovaries. But again, at IVF London, we use very mild stimulation approaches, and we do not feel that the risk of ovarian hyperstimulation is high at all. We expect this to be between 1 and 2%. And again, even in women who feel slightly unwell because of ovarian hyperstimulation, their symptoms can be managed quite well at the clinic level. So what ovarian hyperstimulation is, it's when the ovaries overreact to the fertility drugs and the patient starts experiencing some level of nausea, vomiting, and sometimes they can even have fluid accumulate in their chest. But that's in very, very rare situations. Now, egg freezing and thawing, as I said, there's about 95% survival rate of the eggs. I would also like to add that there is no evidence that the stimulation hormones increases the risk of ovarian cancer. There is also no evidence to suggest that stimulation causes early menopause. I get asked this question day in, day out. So it's very important to understand that there is no evidence that stimulation causes any increased risk of ovarian cancer, nor does it lead you at a higher chance of premature menopause. Finally, just, we have a state-of-the-art laboratory here. We do all egg freezing, thawing, insemination, everything in our lab here in IVF London. And I'd be happy to take any questions. These are just some of our contact details. So any one of you who is looking to get some further information on egg freezing, please do contact us. Our number is 0208-207-4115, or you can email us on info@ivflondon.co.uk. Our website is ivflondon.co.uk, and there's a lot of information on our website as well about egg freezing. So I'll open up any questions, and I can see that there's a lot of questions that are coming up, but
Excellent.
I am happy to answer any questions.
Excellent. Thank you so much for that very interesting, informative presentation. And again, you've been brilliant with it, with all the explanations. I mean, and of course, yes, we will go for your questions. But before that, we have some questions, right? So let's have a look at them, and let's just. I would say that you have mentioned mostly on, of course, on them, but let's just say that those will be our take-home messages. Okay.
Okay.
Excellent. Thank you. So the first question is: so what is the optimum age to consider egg freezing?
This is a very important question, and by and large, Caroline, by the time patients consider egg freezing, it would have been a bit late. So it's all about trying to educate women that what is the right age. And in my opinion, or the global data has suggested that the best time to consider egg freezing is any time from 32 to 37. This is a very, very prime age to consider egg freezing, because after 38, the decline in fertility is very, very sharp and very rapid.
All right, perfect. Thank you so much. It is true that this should be spread, I think, more and more nowadays, to make sure that every woman is aware that there are options as well, right? Perfect. Thank you so much for that. And next one is: so how long does the process take?
So the process is very fast nowadays. So there have been so many developments in the IVF sector, or at least even in the stimulation regimes, that has enabled us to use very short stimulation protocols. We do appreciate that when women are working or when they're busy with education, the whole process needs to be very kind of very well thought through, most importantly, it needs to be non-invasive in their day-to-day life. So the whole process of egg freezing can be finished in around 2 weeks. So hypothetically, a patient can come and see us for a consultation, and as soon as they have their period, they can start on the stimulation, and from 2 weeks from then, they would have their eggs frozen. So it can take anything from 2 to 3 weeks, depending on where you are in your cycle. But the short protocol gives us amazing amounts of flexibility now, and the whole process can be very fast.
Perfect. Thank you once again for explaining this. Next one is: how many cycles of egg freezing will I need?
Again, a very good question, Caroline, and there is no set answer for this. So the way we assess and advise on this concept is by getting women to check their fertility potential. So if you remember, in my first couple of slides, I mentioned that we would recommend women to have a test for a hormone called AMH, and also look at their antral follicle count. Now, we know that a lot of women nowadays have got a declining ovarian reserve. So for example, if a woman has polycystic ovaries, she may only need 1 cycle of egg freezing because she's likely to produce a lot of eggs. But if you have a woman who has got a very low AMH and a very low ovarian reserve, such as an AMH of 1 or 2, then they may not produce that many eggs as a result of stimulation. And such patients may need multiple cycles of egg freezing. So typically, as a law of average, we get women who would consider at least 2 cycles of egg freezing in order to give themselves a good chance in preserving their fertility. And because the whole process is quite fast now, it just takes 2 weeks, as I said, you know, it can fit in quite nicely in the whole scheme of things.
Okay, perfect. Thank you for that as well. And now, how many eggs are required for me to have a baby?
Again, a good question, because this is, in essence, this is the, you know, this is what women are asking, that how many eggs do I need to have a baby? And again, I think there's no kind of magic answer to this, because the factors that govern the answer to this question are age, ovarian reserve. So again, if patients have got a very good ovarian reserve, and if they have quite a lot of eggs produced and they're young, then all the eggs that they have from one cycle will be enough to potentially have a baby. But if we keep this figure of 6% in our mind, so 6% clinical pregnancy rate, so typically I would say that in order to get a 60% chance of being pregnant, you are looking for at least 10 to 15 eggs in storage. I would say, yeah, so 10 eggs to give you a 60% chance if you are 35 or under in terms of age. But as a ballpark figure, if you are a woman in your 40s or early 40s, you may want to consider freezing more eggs, because we know that after 40, it's not necessarily about the number of eggs, it's more about the quality of the eggs that gives you a better chance at getting pregnant.
Excellent. Thank you once again for explaining this one to us. And next one, so is, what is the pregnancy rate with frozen eggs?
So as I said, the pregnancy rate is around 6% per egg thawed out. So if a patient has got 10 eggs, then she's got about 60% chance of getting pregnant. And usually most women do have around 10 to 15 eggs per cycle. As I said, even if they are in their early 30s and if they've got a good ovarian reserve. So I would say that the pregnancy rates between fresh and frozen eggs is the same. So whether you were 34 right now and were considering a fresh egg collection via IVF and wanting to get pregnant, versus freezing your eggs and using them later, your chances of pregnancy are the same, whether you use frozen eggs or whether you use them fresh.
All right, perfect. Thank you so much. And now, last question, when it comes to those most common ones, and of course we will go for your questions. There are plenty of those ready as well. And the question is, so what is the survival rate of frozen eggs?
So the survival rate of frozen eggs depends on age. So we know that in women who are in their 30s, early 30s, the survival rate of the eggs can be very good. This is because the quality of the eggs is a lot more robust, and the eggs can take certain level of trauma during the freezing. Whereas women who are in their 40s have got very fragile eggs, and they may not be able to take the pressure of egg freezing per se. So typically what we expect in women in their 30s is a survival rate in excess of 90 to 95%, whereas in their 40s, we expect a survival rate of around 80 to 85%. Still very good, but there is definitely a decline in survival rate with age.
Excellent. Thank you so much once again. And now it is time for our patient's question. There are plenty of those ready. So are you ready to answer them? Okay, excellent. Thank you. So the first one is right here. Is 20 eggs from a donor considered a good result? Also, how many times should an egg donor donate without diminishing the quality of her eggs? And what would be the ideal time she would wait between each donation?
This is a good question, Angela. So 18 to 20 eggs is plenty from a donor. One also needs to be very cautious that we do not overstimulate donors, because donors also can risk ovarian hyperstimulation. So there's two things here about the number of eggs. In my opinion, 18 to 20 eggs is quite a lot. Ideally, what we're aiming to get in a cycle of egg donation is between 10 and 15 eggs, okay, at the most. So whenever it goes from 18 to 20 or even more, then potentially these two aspects that can be compromised, and I'm not saying it is compromised, but can be compromised. Firstly, the risk of ovarian hyperstimulation. But apart from that, even the quality of the eggs. There have been many studies that have shown that the higher the number of eggs you retrieve, the quality of those eggs starts going down. So we know that there are some clinics out there that will stimulate a donor quite heavily to get quite a lot of eggs, sometimes even 30 eggs. And what they will do is then they will divide those 30 eggs between 3 recipients and give them 10 eggs each. Now, in my opinion, this is not the right thing to do because the quality of those eggs is then going to be compromised. You're better off keeping to only 1 or 2 recipients, but at the same time, giving the couple or the recipients a very good chance of establishing a pregnancy. I hope that answers. Oh, no. The next question is, how long should you wait? Sorry,
Yes.
I just wanted to
Sorry.
answer.
Yes.
How long should you wait between each donation? I would say definitely a couple of clear periods before you go on to your next cycle. I would not advise a back-to-back cycle. You need to wash out those hormones out of the body before you consider another cycle of egg donation. So at least 2 to 3 months is my suggestion.
All right, perfect. Thank you so much for your question and, of course, your help with this as well. Next question is right here. So, my last donor accidentally gave herself the trigger injection, and my doctor advised to cancel retrieval as the eggs would have been too tiny to retrieve and would have been a waste of money and cycle. What is your opinion? Having possible retrieve those eggs and trying to make them into viable embryos?
So again, Angela, I think what your doctor advice was correct. It all depends at what stage was that accidental trigger injection taken. So if the donor has just started injecting herself and was only at about day 6 or day 7 of stimulation, and then the accidental trigger injection was taken, in that case, it's the correct thing to do, is to cancel the cycle because the eggs would have not been mature enough with such little stimulation. But if it was about 10 days or 11 days of stimulation, trigger was at day 12 of stimulation, I would say if the follicles were over 16 millimeters in diameter, then it would have safely, it could have been performed. If the follicles, sometimes it's not only just about the day of stimulation. Sometimes even on day 12 of stimulation, the follicles could not be very big because some women stimulate for a bit longer, even up to 14 days. So I think it's more about the size of the follicles. If the follicles were all above 14 millimeters and you accidentally took the trigger injection, an egg collection could have been attempted.
All right. Thank you so much once again for that question and your answer to that. Next question is here. So, thanks for sharing this great info. I am 50-year-old working currently with a donor 30 years old that has 3 boys. Donor has had few successful donations so far. Average donation count was about 18-12 eggs. How many blastocysts shall I expect given that I have had DNA fragmentation test done recently and the results came out quite good?
Okay, so again, from what you're telling me, the donor is young. She's had proven fertility, 18 to 20 eggs, which is great. I would expect at least 8 to 10 blastocysts from them, at least. Okay, but this is obviously, bearing in mind that, we are just talking about the eggs. Of course, there's an impact of sperm as well, but you're saying that the DNA fragmentation test was normal. So I would expect around 10 blastocysts from those eggs. because donor is young, proven fertility, good number of eggs, hopefully good fertilization should be expected, about 80% fertilization should be expected, and I would definitely say 8 to 10 plus.
All right, excellent. Thank you once again for this. And well, there are plenty more coming, so let me go to the next question. Can you share the difference in success rates if the eggs are frozen before fertilization versus freezing embryos?
This is a very good question, Colin. So we often get asked that should I freeze eggs or should I freeze embryos? And our responsible answer should always be that embryo freezing gives you better outcomes than egg freezing. But it's comparing chalk and cheese. It's got to be understood that when you're freezing eggs, these are eggs. And when you're freezing embryos, they have undergone quite a lot of barriers of development. So an egg, so hypothetically, if you have 5 eggs, you may get to 2 or 3 embryos. Okay, so one has to take that into account, that there is a funnel. Eggs start off at the top end of the funnel, and embryos are the bottom end of the funnel. So comparing eggs and embryos could be comparing apples and oranges. But an embryo frozen gives you a much higher success rate than an egg frozen, if that makes sense.
All right, thank you so much once again for answering this question. Next one is right here. I read that sperm sample is best taken early in the morning if we're doing ICSI. Do you have an opinion on this, as we have male factor issues as well as low AMH and ovarian reserve?
So, Belinda, I believe that it is important to, more than the timing of the sperm production, it is more important that the abstinence is there. So we generally recommend a 2 to 3 day abstinence period in the men. And usually at IVF London, the sperm sample is always taken in the morning. So once the patient has had the egg collection, the male partner will be asked to produce a sperm sample, and the sperm sample will be processed in the laboratory. But there is nothing to say that if the egg collection is in the afternoon, the sperm sample cannot be produced in the afternoon. So there is no evidence to suggest that a sperm sample produced in the morning is better than a sperm sample produced in the afternoon. What is more important is making sure that we have the abstinence period that is required, which is at least 2 days.
Perfect. Thank you once again for that. And now let me go to the next question that we have. So, have you seen a difference in women who take DHEA, the number of quality eggs they produce?
Again, a good question, Belinda. DHEA is mainly recommended to be taken in women with a very low ovarian reserve. It also must be said that the evidence around DHEA is quite average. The Americans use DHEA a lot because, again, DHEA is available over the counter in the US. In the UK, it's not. But with all the papers that I have seen or read, DHEA's benefit is only if it is taken for a period of at least 3 months. So it's a slow acting, benefiting drug. So, or an androgen rather. So I would suggest that if you have a low ovarian reserve, then one has to take a very calculated approach that, do we want to wait for 3 months and risk that ovarian reserve go down further just because we're trying to see if DHEA improves the outcome? Usually women with low ovarian reserve or poor ovarian reserve would not want to wait those 3 months. At the same time, I have seen women who will say that, well, I'm going to have my IVF next month. Is there any harm if I start taking DHEA now? I'll say no. It may not benefit, but it will certainly not harm. Try it. But again, it's got to be understood that, DHEA, you've got to take it 3 times a day as well. So it's pretty much a protocol that one has to really follow. In the UK, clinics are not so pro DHEA. I find the American clinics very pro DHEA, especially with poor ovarian reserve.
Okay, and there's actually another question on this. So I'm worried about the side effects of DHEA.
I mean, certainly DHEA should not be given without consultant prescription, in my opinion. Because some women who have a high androgen level can have quite bad side effects with DHEA. So DHEA is nothing but an androgen as well. So what do we want to make sure that in women where it's contraindicated, we should not be giving them DHEA. So again, I say that, you need to take DHEA under supervision of your consultant, and you shouldn't just take it because your friend from the US has given you a bottle of it.
All right, excellent. Thank you once again for answering and explaining this to us. And next question is here. I am 35 and have endometriosis at the same time as booking a fertility assessment, or sorry, there's
So yeah, I'm not sure what the question is, but she's saying she's 35 and has endometriosis, and so maybe the question is, should I look into booking a fertility assessment? The answer is yes, because most importantly, what you want to know, Candice, is what is your ovarian reserve. I have seen quite a few women who are in their 30s with a very, very low ovarian reserve. Sometimes they're 33, 34, but when they come for an ovarian reserve test or fertility assessment, we find out that their ovarian reserve is very low and they are at a high risk of premature menopause. And again, you'd rather know this information early than later, because if you do know it in good time, then you can at least freeze the eggs or even consider starting your family earlier, because you have a real-time check on your fertility potential. So I think it's very important to get a fertility assessment done. In my opinion, every woman as she turns 30 should have a fertility wellness check done to see what the ovarian reserve is, so that they can plan their future. They can plan when to have kids. They know exactly how much time potentially they have to be juggling family, career, education, etc.
All right, thank you so much. And actually, there's another question from Candice. Okay, I'm looking into egg freezing in both London and Spain, largely due to a no 10-year-old limit and also the shorter waiting times for IVF later due to donor anonymity. Apart from the obvious convenience of having the treatment closer to home, would you say there are any pros and cons to freezing abroad?
Apart from the travel, Candice, of course, that is obviously an inconvenience. And generally, women who are considering egg freezing for social reasons are usually working women. So for them to take 2 to 3 weeks out of their work just to go and freeze eggs abroad can be quite an inconvenience. So I think the biggest inconvenience is being away from your setting. Whereas if you had egg freezing at a clinic in London or UK, then you can continue your lifestyle as usual. For example, at IVF London, we have all of our scan appointments from 7:30 a.m. in the morning. So women come and have their scans, and by 9 o'clock, they're potentially at work. This is not obviously during the pandemic, but if everything in the ideal world was normal, then we get a lot of women coming here for 7:30 scans. They leave the clinic by 8:15, and they work by 9 o'clock. So they can fit the whole egg freezing or IVF treatment as part of their normal day-to-day routine. Whereas, of course, traveling abroad has its own inconvenience. It may be cheaper, yes, but I think when you try and put everything into perspective, including the cost of travel, the loss of income potentially, the holiday that you have to take, the accommodation that you may have to spend on, it probably comes to the same thing. And again, being in a foreign country, the language barriers, are all challenges one has to consider.
All right, perfect. Thank you so much for that. Next question is right here. My consultant thinks there is likely an issue with implantation. So, what's your opinion on having an ERA test?
It's a good question. Of course, this webinar is about egg freezing, but I will answer that. There is emerging evidence on ERA tests. And my opinion is that if you've had 2 or 3 failed IVF cycles, despite having good quality embryos transferred at the blastocyst stage, then I feel it's worth having an ERA test. Because let's not forget, an ERA test is invasive. You have to prepare yourself by taking all the drugs that you would have ideally taken in an embryo replacement cycle. So you have to do a dummy cycle by taking all those injections and drugs. And then you have to perform an ERA test. So an ERA test is not cheap, it's expensive, but also patients have to mimic their body as if they are performing an embryo transfer, which is taking them through a whole dummy embryo transfer cycle. It has its value, I believe, but not as a first-line approach.
Perfect. Once again, thank you so much for that. And there are more questions coming. Any advice you can provide a patient having very low AMH, 0.17 nanograms at the age of 18 at 18 years?
So certainly, I think if a patient has got such a low AMH at such a young age, I would, as long as they're 18, of course, they can be legally treated. One really needs to take an expert opinion from a gynecologist. It may be a case of premature ovarian failure. And if at all there is any ovarian reserve still there, which indicates that there is some there, although the units of measurement of AMH in the UK is picomoles and not nanograms, but we can convert that. But she really needs to take expert opinion and consider egg freezing or fertility preservation, because this is considered to be a low AMH.
Okay. All right. Thank you so much again for that. And next question is actually, what's the difference and benefits of ICSI versus IMSI?
Yeah, so IMSI is a technique whereby you just magnify the sperm and look at it under very high magnification, typically 6,000 times magnification. And what you're trying to identify by magnifying the sperm to that level is to see if you can spot any abnormalities in the sperm head, which are called vacuoles. Now, this is what IMSI typically looks at, but the data has been very mixed about the benefits of IMSI. And I must say that in the clinical setting, we used to use a lot of IMSI about 6, 7, 8 years ago, and now it's kind of died its natural death. So, and that is because that there are better tests that can now look at the health of sperm. So IMSI used to be done in men with high DNA fragmentation. But now you have better and robust tests in the laboratory that can select sperm with much, much lower DNA fragmentation. So IMSI used to be a thing of the past, and nowadays very few clinics are using IMSI because the real-time benefit can be really questioned.
Okay, thank you again for explaining this, of course. And once additional, and does IVF London offer IMSI?
We don't offer IMSI. We actually offer what we call high magnification ICSI. Okay, because with IMSI you have to use what we call oil immersion, etc., etc. So we prefer to use what we call high magnification ICSI, and all of our ICSI is done under high magnification. But as I said, if it is using IMSI purely for high DNA fragmentation, we believe there are more proven methods or more better laboratory technology that can assist in using more viable sperm compared to IMSI. So we don't use IMSI per se, but we certainly use what we call high magnification XC.
Excellent. Thank you once again. And next question is right here. So what's live birth percent when it comes to frozen eggs?
So pregnancy rate is around 6% per egg. I would say live birth rate is around 5% per egg. So again, 10 eggs from a woman who is 35 years old or less, you have a 50% chance of a live birth.
Okay, thank you for clarifying that. And now here's the next question. I'm thinking of to freeze embryos. How many embryos do I need to freeze? My AMH is 0.739 and follicle count is 6. I believe it's about the eggs, of course.
Yeah. So, well, if you're thinking of egg freezing, I would say that you're looking at a couple of cycles, Eve, of egg freezing. If your antral follicle count is 6, your AMH is 0.739, presumably that's nanograms, then I think you're looking at a couple of cycles of egg freezing.
Okay, thank you again for that. And next question is, can I freeze my eggs? FSH LH is okay. AFC 7 AMH of 0.3 IM 40.
Yeah, so this is good question. In some women, we have a what we call a discrepancy between AMH and AFC. And in such cases, the AFC is a better predictor. In fact, today I had a patient whose AMH was 1.3 nanomoles. Okay, as I said, our UK measure is in nanomoles. Okay, so AMH was 1.3, but she has got 15 eggs that she is, we're stimulating her at the moment. And she's got about 12 to 15 follicles that are growing simply because her AFC was good. So she had a good antral follicle count, but a very low AMH. But when you compare AMH and AFC, AFC is a better and a stronger predictor, especially in cases where you have that discrepancy. So I would say the answer to the question is yes, you can certainly attempt to freeze your eggs because your antral follicle count is around 7. What I would expect is around 4 to 6 eggs being retrieved.
All right. Thank you once again for that. Next question is glutathione beneficial for egg quality?
There is very little evidence of that. So again, I think, bearing my recommendations on evidence-based, there is very little evidence for that at all. There is very little that has shown in terms of external supplementation to benefit egg quality. The most important thing to do is to time it right and freeze the eggs whilst your egg quality is better.
Okay, perfect. Thank you once again for answering this question. Next one is right here as well. Upon egg collection, a few eggs were one and were not mature further after denudation. Do you recommend freezing those eggs or just discard them? And what do you expect upon thawing them?
Usually, Raneem, we don't freeze the metaphase 1 eggs, M1 eggs. We would only freeze metaphase 2 eggs. Unless you were a cancer patient, then there wouldn't be an added advantage of freezing metaphase 1 or immature eggs. The common practice is to only freeze metaphase 2 eggs. One has to obviously also make sure that we try and get more mature eggs from you. So if you have a lot of immature eggs, then one should be questioning if the stimulation regime applied was correct or not.
All right, thank you. There's another question from the very same patient. So is it safe to freeze the eggs? All are M2, yet the cycle was cancelled after the thawing. What do you recommend in this case?
So this is very bizarre because why were the eggs thawed and why were the eggs refrozen? Because if it is a matter of the sperm not being available, then the egg should not have been thawed. So it's not easy to give an answer to this because I don't have enough information here. The answer to your question, is it safe to refreeze the eggs? Yes, eggs can be refrozen. But again, as I said in my talk, when you freeze eggs, you are stressing them out to a certain degree. So why would you apply that stress twice unnecessarily? So if this was about not finding sperm on the day, then I would have not thawed those eggs to begin with and only thawed them once we have sperm. I don't know if that answers the question, but
Of course. Thank you so much. If you would like to add anything, just type it in, of course, as well. But still, I guess it is all good. Thank you. Next question is right here. Just give me a minute. Yeah, here it is, the good one. What is your opinion on a nuclear and spindle transfer with a 50-plus-year-old woman and a 23-year-old donor?
okay, so firstly, Angela, I want to say that nuclear and spindle transfer is still under research and development. There's a lot of validation and clinical information that we need on its safety. So I would not recommend that you look into any of this technology because it is still not validated. It is still not considered to be safe. It's important to understand that we're creating life here. We're trying to create a baby here. So we don't want to be experimenting, too early. Technology is moving very fast in reproductive medicine. And I feel it's my responsibility to say that all this technology, including spindle transfer, is very much in its infancy. Maybe in 10 years' time, it will be a reality. But at the moment, there is not enough known about it. I know there have been some live births from Mexico, from China on spindle transfer. But what we fail to understand is how many times has it gone wrong. We only see the number of times that it's gone right, or that's what we hear about. But we don't hear about how many times it's gone wrong. So it's very important to understand that as a scientist, I would be very, very skeptical about using technology which is very raw and not ready.
All right, thank you once again for explaining. That's definitely something to remember as well. And well, we will now go to the question from Candice. Okay, so I have next plan on in currently to control my endometriosis. Sorry, I believe I will need this removed for egg freezing. Is this something that a clinic would assist with, or do I need to anticipate a heavy reliance on my GP who is not taking appointments for the foreseeable?
So, okay, Candice, that's a good question. Your fertility clinic should be able to manage your endometriosis. So it's not always necessary to be addressing the endometriosis before egg freezing, because sometimes in the fertility clinic we use what we call a long protocol for patients with endometriosis, which gives us a much better outcome. So it doesn't necessarily mean that you have to have any surgical intervention to address the endometriosis before egg freezing. But again, it depends on the grade of endometriosis. So there's not that much information again here to go by, but I can tell you that no, it's not mandatory to have surgical intervention before egg freezing for your endometriosis. And at the same time, fertility clinics should be able to manage this for you. You don't have to wait to get a GP appointment unless you're planning to get the whole endometriosis thing addressed at within the NHS. But yeah, I hope I've answered your question, because there are certain stimulation regimes whereby you can still stimulate women with endometriosis and yet get a good outcome.
Excellent. Thank you so much. Once again, there are like 4 questions left, so we will be slowly finishing. But if you have any questions left, just go ahead and type it in. And the question is right here. I am 50 and I have worked recently with a donor, 27-year-old that has 2 kids. Donor donated few times and usual outcome was 18, 20 eggs. However, in my case, the result were the same in terms of eggs count, but I ended up with 4 blastocysts, only one good one after PGS testing. Given that I have had normal DNA fragmentation test results, what could be the reason for such lousy results?
Um, okay, that is quite a poor outcome, especially if your donor is 27 years old. If your donor is 27 years old, she's got 2 kids, she's donated a few times, good number of eggs, um, only 4 blastocysts. Now that's not good. And only one normal after PGS testing. So you're also saying that your partner has had a normal DNA fragmentation test. Uh, it's really challenging, but the outcome should have been much better. Certainly, I think the DNA fragmentation would have been the first thing I would think about, because people always kind of focus on the egg and the egg quality, but they don't necessarily sometimes realize that the other half that makes the embryo is the sperm. So the importance has to also be given to the sperm quality. But you're saying that the DNA fragmentation is normal. I would recommend using technique such as choosing sperm with more intact DNA. And there are some, there are some procedures now available or equipment available in the market. One of them is called Zymot, which we use here at IVF London. It's called Zymot, and it's microfluidic channels through which sperm swim, but sperm only with good or low DNA fragmentation swim through. And then we pick the sperm which has swum through and use them for ICSI or IVF. But I would also question stimulation here, because if the donor is young, proven fertility, good number of eggs, why did you not get a good blastocyst formation rate? So something is not adding up here. It would be very difficult to troubleshoot based on that little information, but it could be anything from sperm to mismanagement of the cycle.
Okay, understood, of course. Thank you so much. Okay. Sorry, next question is right here. When is best day to do AMH test and AFC count? From listening to all of your podcasts and great advice you provided throughout this whole lockdown, you have helped us to decide that frozen cycle is the best way forward for us. So thank you so much, Alpesh.
Thank you, Belinda. I know you've been following a lot of my podcasts and my Insta lives and my Facebook lives. It's been a pleasure to be talking and educating an audience that is interested. So the best time to do an AMH test, Belinda, so AMH can be done at any time in the cycle. There is no set time, but the antral follicle count is best done between day 2 and day 4 of your cycle. So AMH can be done at any time, but the antral follicle count has to be done between day 2 and day 4 of your cycle.
Excellent. Thank you so much for that advice as well. And now let me take a look. Next question is here. I am 38 and have done egg freezing twice at 37, but only 8 eggs have been collected. How many live births are expected out of 8 frozen eggs? I'm thinking of doing freezing for the 3rd time. How many times are safe to take IVF injection? Not be worried about increasing the risk of ovarian cancer. Is a 37-year-old frozen egg better in terms of quality or a 39-year-old fresh egg?
Good question, Sally. And of course, I have, I have been posed very similar question by a couple of friends of mine who've had egg freezing. And if you've had 2 cycles of egg freezing, and considering that I have said that an embryo is potentially better than an egg in terms of outcome, what I would suggest is, if you are considering another cycle, and it would be very wise to consider another cycle, I would consider embryo freezing now, just to kind of keep your options open in both directions. But yes, a 37-year-old egg is more potent than a 39-year-old egg. But if you're going to be creating eggs at 39, then you potentially should start looking at furthering the process, which is trying to create embryos out of it. However, of course, that is if you have a partner right now. Or if you don't have a partner right now, then one can potentially look at considering just freezing the eggs or using donor sperm. So I have a very good friend of mine who's had 2 cycles of egg freezing. She's again 38, and now she's going to be coming through for embryo freezing using donor sperm. She's still single. But it just tries to keep all the options there in the pursuit of having a child. But I wouldn't worry about the risk of ovarian cancer and stimulation. Again, I wouldn't worry about premature menopause. The most important thing to do is try and make sure you add more to that freezer, because in another year or two, the scenario would be very, very different. You may conceive naturally as well. There's nothing to say that women in their 40s don't conceive naturally. You may do. But again, this is purely an insurance policy and looking out for something which is unprecedented, because you never know. This may be the route that you may need to take in order to conceive.
All right, perfect. Thank you so much for that advice as well. And now, next question is, what do you think about PRP, ovarian rejuvenation for women with low ovarian reserve?
So the evidence is very weak on PRP. Again, it's very much in its infancy. Most fertility clinics do not advise the use of PRP when it comes to getting better quality eggs. Again, I think we're quite fortunate in the UK is that any kind of new technology needs a lot of validation, whereas in some parts of the world, these procedures are unregulated. And all I can say is that, in my opinion, PRP doesn't have enough evidence to suggest that it improves ovarian reserve or egg quality.
Okay, perfect. Thank you again for that. There are like 2 questions left. So here's the first one from those. How many embryos do we need to freeze for 100%?
There is never 100% success. But ideally, I think you're probably referring to eggs rather than embryos. But if you are referring to eggs, then as I said, if you are in your 30s, then you should look to freeze about 15 eggs, 15 or 18 eggs, if possible, to give you a very good chance of getting pregnant. But we can never tell you what the magic number is to attain 100% success, because there's so many variables. You mean embryos? Again, it depends on the genetic status of the embryos. So you and I both know that having embryos is one thing, but having those embryos to be genetically normal is another. So I can just tell you that if we apply genetic screening to those embryos, and if you have 3-4 normal embryos out of that genetic screening or after PGS, then you are most likely to get pregnant with a live birth. If you have 3 to 4 euploid or genetically normal embryos, your chances of having a baby are extremely high.
Excellent. Thank you so much once again. Well, it looks like this is our last question, so let's go ahead with it. So I am 47 with lupus. Is it possible for me to go for egg donation treatment? And if you could add what you mean by the way, so we will be able to answer.
So, in my opinion, Bernice, yes, if you are stable and your condition is managed, then you can potentially go for egg donation. But again, I would seek opinion of your fertility specialist, or you need to seek opinion of your consultant who's managing you for your lupus. It is very important to get the all clear from the consultant who's managing your lupus, so that you can then safely embark on treatment. So I wouldn't like to give a very clear answer on that, because I think it can be a complex one. You're saying that you're stable, your condition is managed, but the green light has to be given to you by your consultant.
Of course. Thank you so much again for that. Well, it seems that we will be finishing for today. So already I would like to thank you, Dr. Alpesh, for your time today and for your expertise. Lots of answers as well. And to all of you for joining us. And there is a question, I think, but let's wait. Can you specify what do you mean exactly? There's only one part of that. Okay, and let me see. Yeah, you just please let us know what. Okay, there's another part. To do an insemination.
So you're mentioning IVF, and yet you're mentioning insemination. These are two different types of treatment. So artificial insemination is obviously when we just inseminate the uterus with the sperm, whereas IVF is a lot more involved, because we are super ovulating the woman, we're giving hormonal injections, we're collecting the eggs, we're fertilizing the eggs, we're creating embryos, and then transferring embryos. So yeah, if you mean IVF, yes, certainly you can have IVF. You would first need to have a consultation. We would then assess your suitability for IVF. We would also need to test your partner for the sperm side of things. So the way forward would be an initial consultation, and then we would assess the suitability for IVF.
All right, thank you. Well, actually, sorry, the patient has added she meant artificial insemination, but I guess the consultation is still.
Yeah, the consultation is still needed. But one thing I want to add, Yaskia, that if you are going to consider artificial insemination, your fallopian tubes may need to be tested to see that your fallopian tubes are open. Because if a couple has been trying naturally for a year or so and conception has not happened, despite having a normal sperm count, then it might be necessary for the woman to test if the fallopian tubes are open.
All right. Perfect. Thank you so much. In such case, I guess that was our last question. So, everyone, thank you so much for your questions, for joining us tonight. And well, I definitely believe it was very useful for you. So, thank you so much once more. Is there anything you would like to add?
Thank you so much, everyone. It's been very, very interactive. I hope I've managed to answer some of your questions. And I really enjoyed my time here today, because we spoke about many things in addition to just egg freezing. And it's always great to be interacting with an audience that is interested in knowing more about reproductive medicine. So thank you so much. And if you have any questions, you can get in touch with me on my email address, which is info@ivflondon.co.uk. I'll repeat, info@ivflondon.co.uk, or you can connect via our website, which is ivflondon.co.uk. Thank you so much, Caroline, once again for giving me the opportunity to speak on your platform. And I wish all of you well. Hope all of you are keeping well and safe, and hope we'll soon be much stronger at the other end after the pandemic eases off. Take care, all of you.
Thank you so much. It's always a pleasure to have you. So huge thanks. And I just want to remind everyone that this has been recorded, so you will be able to find it within the next few days on our site, myivfanswers.com. You can also subscribe to our YouTube channel. That way you will be notified when the video is actually uploaded. And of course, as always, I encourage everyone to simply register for our events to save your spots. And once again, we will be back here very soon, as we are having another live event at 8 p.m. UK time. So if you don't have anything else to do, then I hope you will be able to join us as well. Huge thanks, Dr. Alpesh. It's been a pleasure, and it's always a pleasure to have you here. And well, take care, and I hope we will be able to do it again. Thank you.
Thank you. Thank you so much. Take
Thank
care.
you.
Bye
Bye.
bye.